Anaphylaxis and epinephrine by injection, presented by Macomb-Oakland Regional Center. As a caregiver, you have a unique and critical role in helping to facilitate the overall health, safety, and well-being of a very vulnerable population. You are a vital resource and bridge to health and wellness for the people you are providing care for. In this training, it is our hope and privilege to provide you with the most current and accurate healthcare knowledge to assist you in improving and celebrating the lives you support. What is anaphylaxis? It is an allergic reaction that is always a medical emergency. Anaphylaxis is a generalized systemic reaction, meaning it affects the whole body, to an allergen. It is frequently fatal and leads to anaphylactic shock. It usually occurs within seconds to minutes after contact with an allergen. An allergen is a substance capable of causing an allergic reaction, such as food, medication, or bee sting. What are some causes of anaphylaxis? Food, including peanuts, tree nuts, and eggs. Shellfish, which would include shrimp, oysters, crabs, lobster, clams, mussels. Food additives, such as aspartame, spices, or MSG. Medications, for example, something like antibiotics, blood products, insect bites, fire ants, bee stings, wasps. Certain vaccines and latex, such as gloves. Signs and symptoms of anaphylaxis leading to anaphylactic shock. Skin that can be seen as hives, swelling, itching, warmth, and redness. The respiratory system, which would include coughing, wheezing, shortness of breath, chest pain or tightness, throat tightness, trouble swallowing, a hoarse voice, nasal congestion, or hay fever-like symptoms. Gastrointestinal, that can include nausea, stomach pain or cramps, vomiting, and diarrhea. Cardiovascular, dizziness, lightheadedness, pale and blue color of the skin, along with weak pulse, fainting, shock, and loss of consciousness. Neurologically, it can affect you by creating anxiety, feelings of impending doom, feeling that something really bad is about to happen, and headache. Other symptoms can also be uterine cramps. How is it treated? It is treated with a drug called epinephrine. It is the most effective drug for counteracting the potential lethal effects of anaphylactic shock. How does epinephrine work? It creates constriction or tightening of the blood vessels, which decreases swelling and also helps to increase blood pressure. Also narrowing blood vessels in the skin and intestine to increase blood flow to major muscle groups. It increases the heart's contraction and heart rate, which can help to reverse and stop cardiovascular collapse. Epinephrine relaxes the muscles around the airways in the lungs, helping the airways to open up so the individual can breathe. Lastly, it prevents the release of additional allergic chemicals, which aids in stopping further progression of the allergic reaction. Epinephrine by injection is made by a number of different pharmaceutical manufacturers. It comes in different dosings specific for adults and children. The administrative packaging may look different depending on the company making it. However, the route is the same, and that is by injection. In this training, we only are focusing on administration of adult dosing and protocol within the population of the individuals we serve. Epinephrine by injection. Examples from different pharmaceutical manufacturers. This is just a photo of different manufacturers of epinephrine that are very commonly prescribed in the Tri-County area. And there's a number of different brands, and these are some photos of what those might look like. The next several slides are the administration instructions on 3 of the most commonly prescribed epinephrine injection medications. You can watch the instructions needed to administer the medication in an anaphylactic emergency that may pertain to the individual you care for. Remember, there are a number of different epinephrine injection medications, and one should always reference the instructions pertaining to the brand and manufacturer of the prescribed medication for the individual that you serve.
Practicing with the Epi-Pen training device can help ensure you, as well as your family and friends, know how to use the Epi-Pen auto-injector in the event of a severe allergic reaction. It's very important to only use your training device when practicing. Never use a real Epi-Pen to practice on yourself or others. The training device works the same as Epi-Pen, but without a needle or its medicine called epinephrine. The training device looks different from Epi-Pen. It's clearly labeled Trainer, and it's gray, while Epi-Pen is yellow, and Epi-Pen Junior is green. To use, grasp your Epi-Pen auto-injector with the orange tip pointing downward, blue to the sky. Remove the blue safety cap by pulling straight up. Do not bend or twist it. Orange to the thigh. Place the orange tip against the middle of your outer thigh. Swing and push the orange tip firmly into your mid-outer thigh until you hear a click, and hold on your thigh for 3 seconds to simulate drug delivery. Count slowly. 1, 2, 3. Practice as often as you need. Reset the training device by replacing the blue safety cap, placing the orange tip on a hard surface, and squeezing the sides of the orange tip as you push down. The training device is now ready to use again. The training device can be used to teach family and friends how to use Epi-Pen at the first sign or symptom of an allergic reaction in case you aren't able to get a free Epi-Pen training device. Or for more information about severe allergies and Epi-Pen, visit epipen.ca.
If having an allergic emergency, pull red safety guard down and off of Auvi-Q. Place black end against outer thigh, then push firmly until you hear a click and hiss sound, and hold in place for 2 seconds. 2, 1. Injection complete. Seek emergency medical attention. This Auvi-Q has been used and should be taken to your physician for proper disposal and a prescription refill.
Indication. Auvi-Q epinephrine injection USP is a prescription medicine used to treat life-threatening allergic reactions, including anaphylaxis, in people who are at risk for or have a history of serious allergic reactions. Important safety information. Auvi-Q is for immediate self or caregiver administration and does not take the place of emergency medical care. Seek immediate medical treatment after using Auvi-Q. Each Auvi-Q contains a single dose of epinephrine. Auvi-Q should only be injected into your outer thigh through clothing if necessary. If you inject a young child or infant with Auvi-Q, hold their leg firmly in place before and during the injection to prevent injuries. Do not inject Auvi-Q into any other part of your body, such as into veins, buttocks, fingers, toes, hands, or feet. If this occurs, seek immediate medical treatment and make sure to inform the healthcare provider of the location of the accidental injection. Only a healthcare provider should give additional doses of epinephrine if more than 2 doses are necessary for a single allergic emergency. Rarely, patients who use Auvi-Q may develop infections at the injection site within a few days of an injection. Some of these infections can be serious. Call your healthcare provider right away if you have any of the following symptoms at an injection site: redness that does not go away, swelling, tenderness, or the area feels warm to the touch. If you have certain medical conditions or take certain medicines, your condition may get worse or you may have more or longer lasting side effects when you use Auvi-Q. Be sure to tell your healthcare provider about all the medicines you take, especially medicines for asthma. Also tell your healthcare provider about all of your medical conditions, especially if you have asthma, a history of depression, thyroid problems, Parkinson's disease, diabetes, heart problems, or high blood pressure, have any other medical conditions, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Epinephrine should be used with caution if you have heart disease or are taking certain medicines that can cause heart-related cardiac symptoms. Common side effects include fast, irregular, or pounding heartbeat, sweating, shakiness, headache, paleness, feelings of overexcitement, nervousness or anxiety, weakness, dizziness, nausea and vomiting, or breathing problems. These side effects usually go away quickly, especially if you rest. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. Please see the full prescribing information and the patient information at www.auvi-q.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.
Hello, I'm Dr. Julie Brown, and we are looking at the Epinephrine auto-injector made by Amneal Lineage Therapeutics. It is a generic for Adrenaclick, and it says Impax on the label here. Impax is now a subdivision of Amneal, and you open the case by twisting, and here is the device, and you can again see the information about epinephrine. You can see it has a fairly small viewing window there. And you can actually see a little bit more of a viewing window if you pull the cap down gently without pulling it off. There are some instructions for use on the back. And there are some additional instructions if you peel back the label. Mostly about what to do after use, and some safety information and prescribing information. This device has two caps. You can take off the caps in any order. And then you just hold it against your thigh, lateral thigh, and you fire. And hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It does not have a needle cover, so you put it back in the case for safety to prevent needle stick injury. And that's it. Be safe, be well. Thank you for watching.
What is your responsibility? Anaphylactic shock is always a life-threatening medical emergency, and you must call 911. Your job responsibility is to react swiftly to any emergency condition using your skills in first aid and CPR. You must report the emergency immediately to persons who can help you support the life of the individual. How to prevent a life-threatening allergic reaction. To prevent anaphylaxis, always know the allergies of the person to whom you are administering medications. Always be aware of the individual's surroundings and possible exposure risks. Be aware that some individuals are more prone to allergic reactions, such as a person with hay fever, asthma, and food allergies. Always be prepared for allergic or anaphylactic reactions. Be prepared. Always have the individual's injectable epinephrine available at all times, at home and when out in the community. Remember, an anaphylactic reaction can occur at any time, even if the person has never exhibited previous allergies and their record indicates that they have no known allergies. In conclusion, a brief video to review this valuable information.
What are signs of anaphylaxis? Knowing them and what to do could save lives. Anaphylaxis is a life-threatening allergic reaction. It can happen immediately or within minutes after exposure to a trigger and can worsen rapidly. You should call your local emergency number immediately if someone is showing signs of anaphylaxis and get them to an emergency room as quickly as possible. Common symptoms you should be aware of may include hives, trouble breathing, tightness of the throat, vomiting, abdominal pain, dizziness, and low blood pressure. What causes anaphylaxis? The most common triggers are certain foods, insect stings, and medications. Foods are the most common cause in children and young adults, while medications and insect stings are more common causes of anaphylaxis in older adults. If you have had or think you've had an anaphylactic reaction and you haven't seen a healthcare provider, contact them for advice. They can safely use diagnostic testing to help identify what the trigger may be and provide you with an anaphylaxis emergency care plan. Find out more at allergyinsider.com/anaphylaxis.
A disclaimer. Whereas this learning module is designed to give you a general overview of the topic, the specific treatment plan for the person you are supporting needs to come from an assigned medical professional to ensure a safe, person-centered, person-specific practice. And as always, a big thank you to all of you and everything you do in helping keep the individuals we serve safe and healthy. We want to also thank you and every one of you for your hard work, dedication, and always keeping the well-being of the individuals we serve a priority.